Could you imagine not being able to enjoy the view of a stunning sunset? What about not being able to recognise the face of an old friend on the street? Did you know that 1 in 7 Australians over the age of 50 show some evidence of macular degeneration? That's around 1 million people. With me is Julie Heraghty. Julie's the CEO of the Macular Disease Foundation of Australia, and she's going to tell us more. Welcome, Julie.
Good morning, Dr. John. Macular degeneration is the leading cause of blindness and severe vision loss in this country, and over 50% of all blindness is caused by this disease, and it's primarily affecting our older Australians.
Where does macular degeneration occur in the eye?
Well, it occurs at the back of the eye.
At the back?
At the back of the eye, not the front. And at the back of the eye is this light-sensitive tissue called the retina. And right in the middle of the retina sits the macula, which is responsible for our central vision, which enables us to read, drive, see the faces of our loved ones and see colours clearly.
And Julie, who's at risk of getting macular degeneration?
Well, those at risk include those over 50, and the risk climbs as you get older. Smokers. If you smoke, you have 3 to 4 times the risk of developing the disease.
Wow.
Yes, and a direct family history. If someone in your family, direct family, has macular degeneration, you have a 50% chance of developing the disease, and over 70% of cases have a genetic link.
Now, Julie, there's no cure for our macular degeneration. What can people do to reduce the chances of getting it, and if they've got it, reduce its progression?
Well, the best thing to do is to follow the Foundation's eye health checklist. That includes having your eyes tested, a macular check, stopping smoking and getting help if you can't. Thirdly, diet and lifestyle, eating a healthy, well-balanced diet with eye health foods, and keeping a check on your weight and exercising regularly, and considering an appropriate supplement in consultation with your doctor.
Now, what sort of symptoms should people be aware of?
Well, firstly, we shouldn't wait for symptoms,
Right.
Dr. John, but have your eyes tested. But in between, we should be watching all the time for these symptoms. We call them the 4 Ds. The first is difficulty with fine vision, like reading. The second, distortion, where straight lines appear wavy or bent. Thirdly, distinguishing faces becomes a problem. And the last one, dark patches or empty spaces in the centre of your vision. Because, Dr. John, early detection is critical to saving sight. We can save sight in some cases, but early detection is critical.
Now, Julie, what else can people who are watching us at home do?
Well, between visits to your eye care professional, you can use this little simple tool called an answer grid, and you can just pop it on your fridge, use it in a well-lit room, use your normal reading glasses, place it about 33 centimetres from your face, and put one hand over one eye and test for any changes in the grid, in the vision, or symptoms, and put another hand over the other eye and do the same. And if there are any changes, we contact our optometrist or ophthalmologist immediately.
That's so interesting, Julie. All morning show viewers can get their free magnetised Amsler grid and an information kit on macular degeneration by calling the Macular Disease Foundation Australia on 1800 111 709 or visiting mdfoundation.com.au.
And Dr. John, I can't emphasise enough how important it is for those over 50, for your viewers, to have an eye test and macular check, and to make sure they never ignore any changes in vision, because early detection can save your sight.
Thanks, Julie.
Thank you, Dr. John.
And that number again is 1800 111 709.